Hello, my name is Georgia Rourke. I am a 5th semester nursing student. Today is November 22nd, about 9:45 in the morning, and I will be doing my final physical exam video for health assessment. So before, I want to make sure I walk in the room. Hello, my name is Georgia. I'm going to be your nurse today. How are you doing?
Good.
Good. I would provide for privacy. And I'm going to ask the patient, can you tell me your name and date of birth?
Nicole Otto, 3299.
Perfect. I'm going to have you put this gown on with the slit in the back, okay? And I'll come back in whenever you're ready.
Okay.
So we would say that I would go out of the room and she would put on the gown and let me know when she was ready for me to come back in. But for video purposes, she's got it on. Okay. Okay. So first thing I'm going to do is get her vital signs and her weight and height and assess her level of consciousness. So Miss Nicole, can you tell me how much you weigh and what your height is?
I'm 5'6" and I weigh 140.
Okay, perfect. Do you know where you are at today?
At the hospital.
Okay, and you said your name was?
Nicole.
Okay, and do you know what today's date is?
November 22nd.
And the year?
2019.
And who the president is?
Donald Trump.
Okay, so she's oriented to person, place, and time. So I'm going to go ahead and I'm going to do some vital signs, okay?
Okay.
So I'm going to go ahead and get her temperature. Go back behind the ear. Perfect, 98.3. Okay, then I'm going to go ahead and get your temperature. Okay, I'm going to put this on your arm. Okay, I'm going to pump it up and it might feel a little tight on your arm, okay?
Okay.
Hold on. I'm gonna do my things ready. I want to make sure it works. Okay. Okay. Blood pressure was 111 over 79. I'm going to go ahead and going to take your pulse here, okay? Okay, I got 82, and then I was counting her respirations as I was talking to her, and they were 17, so that's good. So now I'm going to go ahead and start my assessment. I'm going to start by assessing the skin. So I'm going to start with the arms, assessing the color, the temperature. There's no moisture, it's warm. I don't see any cracks, lesions, or scars or anything like that. I'm going to do capillary refill. Perfect. And then I would also go down. I'm going to have you uncross your legs. And I'm going to assess the skin on the legs as well. Obviously, I would assess all the way up the leg, but because she has pants on, so I would do the same on the legs. The color, temperature is warm, pink, no scars or lesions or rashes, anything like that, so that's good. Okay, I'm going to go ahead and start assessing from the head down. So I'm going to start with the hair. I'm going to inspect the scalp for any scars or any bumps or lumps or any type of lesions, and I don't see any. The hair is evenly distributed. Texture is full and soft. and no patches, which is good. So now I'm going to move on to your face. Okay. Have you had any issues with your vision? No? Okay, perfect. I'm going to do a couple tests on you, okay?
Okay.
Okay, so first, I'm going to just look at the eyes, the external structure. I don't see any eyebrows or eyelashes missing or anything irregular with those. I'm going to check the conjunctiva. Okay, I don't see anything abnormal there either. Okay, so the first test I'm going to do for you, I'm going to hold out my fingers with numbers on the sides of you, and you're going to tell me what they are, okay?
Okay.
Okay.
2, 3, 1, 2, 1, 3.
Perfect. Okay. Now I'm going to go ahead and I'm going to have you hold this card. I'm going to have her hold this card 14 inches away from her. So I'm going to go ahead and have you hold this. I'll measure out 14 inches away. So right there. I want you to read the smallest line that you can.
4, 2, 6, 7, 3, 9.
Perfect. Okay. So her vision is 20/20. That's amazing. Okay. Now I'm going to go ahead and I'm going to have you watch my pen light, okay? With your eyes, but keep your head straight, okay?
Okay.
Perfect. Okay, and now I'm going to go ahead and I'm going to shine a light in your eyes. I'm checking to see if her eyes are reactive to light, and they are, which is good. And I'm going to go ahead and have you follow my pen light in, okay? For accommodation. Perfect. All right, so there's no abnormalities there with her eyes. Her pupils were equal reactive to light, and they were accommodated, which is good. So I'm going to go ahead and move on to the next thing. I'm going to go ahead and inspect the ears. So I'm going to inspect both sides of the ears with each other. I'm going to inspect the external structure. Do you feel any tenderness?
No.
Okay. I'm going to be assessing for any swelling of the ear, any redness, rashes, anything abnormal, and I don't see anything, so that's good. I'm going to go ahead. I'm going to take a look inside the ears. Okay. Might feel a little funny, okay? I'm going to go ahead and pull up and back with the ear and looking inside for anything. I'm looking at the eardrum, the canal. Everything is intact, which is good. I'm going to go ahead and pitch this one in my trash when I'm done. I'm going to get a new one for the other side. I'm going to come around and look at the other ear. Okay, I'm looking at the eardrum and canal again. Everything is intact, which is good. So I dispose of these. Okay, now I move on and I'm just kind of looking at the face, feeling your temporal artery here on the sides of her face, and then your temporomandible jaw. Can you open your and close? Okay, can you kind of go back and forth? Perfect. All right, and then can you push down? Okay, and then push to the side and push the other side. Awesome. Can you tell me if you feel any swelling or any tenderness? I'm feeling for swelling, no swelling anywhere.
No, it doesn't hurt.
Perfect. Okay, so now I'm assessing the nose, just the external structure. Everything looks intact. I don't see any discolorations or anything. I'm going to have you take one finger over one side of your nose and breathe in and out, and then do the other thing with the other side. Perfect. Okay, so now I'm going to go ahead and I'm going to move on to her mouth, and I'm going to have her open, and I'm going to look inside at the tongue, her tonsils. Nothing looks swollen. Her teeth are all intact, no broken teeth or anything. I don't see any lesions or rashes on her gums. Looking at the hard and soft palate are all intact, and I don't see any cracks or anything around her mouth, on her lips or anything. So I'm going to go ahead and move on to the neck. So first I'm going to inspect the neck just for any discoloration, rashes, lesions, anything like that. I don't see anything, so I'm gonna go ahead and feel around. Feeling for any lumps. Do you feel tenderness there? No?
Nope.
Okay, I'm feeling down here in the cervical lymph nodes. No tenderness there either?
Nope.
Okay, I'm feeling as the trachea is midline. And I'm feeling the thyroid gland. Perfect, everything's intact. I'm gonna feel for the carotid artery. Okay, and then I'm gonna feel on this side. And the carotid artery is 2+ on both sides, which is excellent. Excuse me. Now I'm going to go ahead and start with my patient's chest, the front part. So I would have my patient either pull down part of the gown or unbutton a side, but for video purposes, we're just going to pretend that it's visible. So I would look at the chest. I'd be inspecting for any color characteristic changes, any rashes, lesions. I'd also be assessing her breathing as her chest is going up and down. I don't see any abnormalities there. I'd also be assessing the expansion, and it should be wider side to side than front to back, and that's excellent. I'm going to go ahead and feel around. You said you don't feel any tenderness here?
Nope.
No? Okay. And I'm going to listen in 6 different spots. Take a deep breath. And again. And again. And again. And again. 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 And on the sides. Deep breath. And again. And one more. And last one. Okay, so I didn't hear any types of crackles or anything that would indicate fluid buildup in the lungs, which is excellent. I'm gonna go ahead and have you, if you can, are you able to sit up on the side of the bed?
Yeah.
This side away. Okay, so now I'm gonna go ahead and do the back. This would be open, obviously, with the skin showing. I'm gonna go ahead and first, I'm gonna come around here. I'm gonna be inspecting the back. Any color changes or abnormal moles or anything, I'm inspecting the skin. I'm going to also be inspecting how she's breathing for that chest expansion. I'm going to go ahead and have you breathe in and breathe out. Perfect. Her rib cage is expanding when she breathes, which is good. I'm going to go ahead and listen. Deep breath. Again. Perfect. Okay, I'm going to go ahead and I'm going to percuss in those same 7 spots. Side. Okay. Now I'm going to go ahead and I'm going to be putting my hands on you and I'm going to have you say 99, okay? Okay, go ahead.
99.
And again.
99.
And again.
99.
Okay, perfect. You can go ahead and lay back down if you'd like. Okay, now I'm going to go ahead and move on to her heart. I'm going to go ahead and first I'm going to palpate the 5 areas here. Just tell me if you're uncomfortable or anything. Okay, can you take a deep breath in for me? Perfect. So I'm just feeling for any heaves, lifts, or thrills or anything abnormal. I don't feel anything, which is good. I'm going to go ahead and listen in all these spots. Okay, can you take a deep breath and hold it? And release. And again. And release. And again. And release. And again. And exhale. And then I'm going to be listening to the point of maximal impulse down here. Perfect. And exhale. And then I'm going to go ahead and do the same thing with my other side. Deep breath. Exhale. Deep breath and exhale. Deep breath and exhale. Deep breath and exhale. And then the point of maximal impulse. Okay, so I was feeling and listening to the aortic, pulmonic, mitral, and tricuspid as well as the point of maximal impulse. So now I'm going to go down to my patient's stomach. So I would have her uncovered, probably from the side, and I'd be assessing the skin for any color changes or anything abnormal. I'd also want to be making sure I'm watching and listening and looking for anything like pulsations, audible bowel sounds, anything like that. I would want to assess the umbilicus, around the umbilicus, and I would want to go ahead and take a listen to each quadrant. Okay, so I heard normal active bowel sounds in all 4 quadrants, which is excellent. So now I'm going to go ahead and percuss. Okay, have you been feeling any tenderness in your abdomen lately? Okay,
No.
I'm going to go ahead and lightly touch on your abdomen. You just tell me if you feel anything sore. Okay, touching here. No soreness?
No.
Okay, I'm going to go a little bit deeper. Do deep palpations. No soreness or anything? Okay, perfect. So now I'm going to go ahead and I'm going to be assessing her upper extremities here. So I went ahead earlier and I already assessed the skin on her arms and her capillary refill. Now I'm going to be assessing her range of motion and her strength. So I'm going to go ahead. Can you raise your arms above your waist and then your arms down? Can you take one arm back behind you and then the other arm behind you? And then if you want to sit up on the edge of the bed, it might be easier. Can you do one arm behind your back and then the other arm behind your back? Perfect. So good range of motions in her shoulders. Can you bring your elbows up like you're going to take a bite of soup and down? And then your wrists, can you go down, up, side to side? Okay, and then your fingers, can you open, close? And then can you do your thumbs? Perfect. And then can I go ahead and have you grip my hands as hard as you can and let go? Perfect. And then I'm going to go ahead and have you put your arms back up like this. Okay, push down. Now don't let me pull you. Okay, perfect. And then can you shrug your shoulders? Perfect. All right. Now I'm going to go ahead and move down to the lower extremities. So I kind of already assessed her skin color and everything on her, excuse me, on her lower extremities earlier. I would want to check for the color and any abnormalities of her skin, any irregular moles. I'd assess the distribution of hair on her arms and her legs. And I'm going to go ahead and have you, I'm going to go ahead and have you stand up. Okay, so I'm going to go ahead and have you do your legs forward and backward. And then the other one, forward and backward. Perfect. So that's, I'm assessing her range of motion of her hips. Can you move side to side like this? Perfect. And then side to side. Excellent. And then while you're up, can you move your head, touch your ear to your shoulder on both sides? Look up, down, and side to side. Perfect. All right. And then I'm going to go ahead and have you sit down on the edge of the bed. Can I have you put your leg up straight and down, and your other one up straight and down. Okay. And then I'm going to have you take your feet, and I'm going to have you roll them in towards each other and out towards each other. And then can you push them up and down? Perfect. Okay. So now I'm going to go ahead and I'm going to assess her strength. So I'm going to have you push up on my hand, up on my hand. Okay, and I'm going to go ahead and I would remove my patient's shoes. Are you comfortable with me taking your shoes off? No? Okay. In real life, I would be assessing my patient's capillary refill in her toes to make sure it was less than 3 seconds. And then I would feel her pedal pulses here on both sides. And then I'd also be feeling her posterior tibialis pulses. And then her popliteal pulses, which is right behind her knees. Excellent. Those are all 2+, which is fabulous. Okay, while you're up, I'm going to go ahead and have do her reflexes. So I'm going to go ahead. Are you relaxed?
Yep.
Okay. And I'm going to do it one more time. Perfect. And again. Excellent. Now I'm going to take this bigger side from the back of her ankles. Okay, her reflexes reacted on both of those. I'm going to go ahead and have you take your feet, and can you push them against me, and then don't let me pull them back too far. Excellent. Okay, and then last reflex I'm going to do is her bicep here. So I'm going to take my thumb and then hit it. Perfect. Perfect. Okay, now I'm going to have you stand up again, because I'm going to do a test here for you. I'm going to have you close your eyes, stand straight with your arms out, kind of like you're holding 2 things of soup in your hand, okay?
And close my eyes.
And close your eyes for 30 seconds, okay? And I'm going to be here holding on to you, or by you, just in case. I'm going to be assessing her arms, making sure that one doesn't droop more than the other. If so, that could be a sign of abnormality or stroke or anything like that. Perfect. Okay, you can go ahead and open your eyes. And I'm going to have you walk from here to this blue cart thing. Just normal.
Just walk.
Yep, just a normal walk. Okay, and then come back. Excellent. And then I'm going to have you do with your heel to your toe and try and walk in a straight line, okay? Excellent. And turn around and come back. Perfect. Okay. Excellent. You can go ahead and sit back down. Okay. You can go ahead and lay down if you'd like. Okay. So now I'm going to go ahead and I'm going to, let's see. Before I do, I'm going to do some funny things on your skin for your sensation, but I kind of want to go backtrack because I forgot to do something, okay? So I want to make sure that I am doing her tests for her ears, because I did her eyes, but I never did your ear test. So I'm going to go ahead and do those. So I'm going to do this tuning fork on the table, and I'm going to hold it above her head on her scalp. Tell me if you feel it on one side more than the other.
No, it's on both.
Okay,
Cool.
perfect. And I'm going to do it again, and I'm going to put it behind your ear. And you're going to tell me when you stop hearing it, and then I'm going to bring it out from behind your ear, and I'm going to have you tell me if you hear it, and then when it stops, okay?
Okay.
Okay.
I hear it. Okay, I don't hear it anymore. Yeah, I hear it. It stopped.
Okay, perfect. So now I'm going to go ahead. There's one other test. It's called the whisper test. I'm going to stand 2 feet behind you. And I'm going to whisper a series of 3 letters and numbers. So I'm going to measure out 2 feet behind me. And I'm going to whisper
J3Q.
Excellent. I'm going to go ahead and go to the other side.
F3T.
Perfect. beautiful hearing. Okay. Sorry
That's
to
not what my mom says.
Okay, sorry for backtracking, but I'm going to go ahead and continue on now with what I was doing. I'm going to be taking some different things and touching them to your skin, and I'm going to have you close your eyes, and you're going to tell me what you feel, okay?
Okay.
All right, so go ahead and close your eyes. I'm going to start with your face. You just tell me what you feel.
Something soft,
Okay,
something kind of sharp.
perfect. Okay, now I'm going to move on to the arms.
Something warm.
Awesome. Okay, I'm going to move on to the legs.
That feels cold.
Perfect. Okay, I'm going to do the hands.
That's sharp.
Okay,
That's soft.
and then I would do her feet as well. But since she doesn't want her shoes off, I'm just going to tell you I would do that. So I would do probably something soft or sharp on her feet as well. Okay. Last thing I'm going to do for you today.
Can I open my eyes?
You can go ahead and open your eyes, sorry. You can go ahead and I'm going to have you touch your fingers to each other like this. Excellent. Just checking your coordination. And have you take your finger from your nose and touch my finger and back to your nose. Excellent. All right. So I'm going to go ahead and let the doctor know kind of how the assessment went, and I don't see or hear or feel any abnormalities, so I would let the doctor know that, and then I would also suggest, if I needed to, any type of follow-ups that the doctor might end up recommending, except that everything seemed to be normal. So, thank you.